So first of all, let me thank the organizers for inviting me, to Mr. Srihari Siddhaye, Mr. Najmuddin, Shri TPR Unni, and Mr. Inder Bhalla. And I'm indebted to be with you today evening to discuss diabetes. I'm going to talk about how to consult a diabetes doctor. We all know when to consult a doctor. We consult a doctor when we are sick. But I'm just going to talk about something relating to diabetes, how to consult a diabetes doctor. So this is from a chronic disease perspective, and this is like diabetes and thyroid diseases. And I'm going to talk about little things that matter. So I'm going to divide my talk into three areas. I'm going to talk about, sorry, just a moment. So I'm going to talk about what to do when you first enter the doctor's chamber before entering, during the consultation, and when you leave the doctor's chamber. This is not rocket science and very simple things, but I thought I will discuss them with you. So first is to do research to find a good doctor to treat diabetes or thyroid or any chronic disease you may have or any disease you may have. You may find a very famous doctor on the internet, but that doctor may not be the good doctor always. So it's important to read reviews of the doctor. It's important to search for the doctor on the internet. But it is always good if somebody you know has been to that doctor, and that doctor comes across as compassionate, caring, and approachable. So those are the little things that matter when you see a doctor. But yes, definitely, I think you should do some research to find out before you put your health in the hands of any doctor. Before going to see a doctor, it's always good to take an appointment and make sure you go to a doctor who actually tries to keep up that appointment. Now, during consultation, it's very important to, may I use the word, to take the maximum information from the doctor. And that is very important for a disease like diabetes. For example, what is diabetes? Diabetes is a disease of high blood glucose levels. Why do we treat diabetes? And as a doctor, whenever I ask patients one question, why do we treat diabetes? Patients say, अरे डायबिटीज का इलाज तो हम लोग क्यों करते हैं भैया, हम हाँ थोड़ा सा ना इलाज नहीं करेंगे तो हार्मोन्स तो ये ऑर्गन्स की डैमेज होती है. That diabetes, if you don't treat it, it causes damage to various organs. So I ask the patient, what organs? Patient says liver and then things, but it's not the liver. Liver also gets affected, but we treat diabetes because it can affect 5 things. It can affect the eyes, it can affect the kidneys, it can affect the feet, it can affect the heart, and it can decrease the immunity by and therefore predispose people to infections like COVID or tuberculosis. So that is the reason we treat diabetes. It's very important to know why we treat diabetes, and it's very important that the doctor explains to you why diabetes is treated. And that's why we treat diabetes. And the treatment of diabetes is diet, physical activity, exercise, which includes exercise, medication, and checking. So then we look at during the consultation. So it's important to bring all the documents for when you go to the doctor for consultation. Sometimes patients bring just the previous report. Sometimes people bring the prescription. Sometimes people bring just the bill. Many times I've seen people just bring the bill of the medication saying, we are taking these medicines, doctor, you prescribe your medicine. But it's very important to know that what medicines were you taking, the prescription if possible. And it's also good for doctors to know the notes of the previous doctor, because a doctor is like, in many ways, a detective. All the information, all the dates of the previous notes, the previous events, the reports, any x-rays, the images, all are welcome, because you may find nuggets of information which will help the doctor treat. And this is very important in diabetes, because, for example, if I know that the patient has had an eye checkup, when I say eye checkup, many people just get the checkup for the spectacles. That's not the eye checkup in diabetes. In diabetes, a special part of the body called a retina is affected. You are seeing this image in front of your screen because this image is falling on the screen of your eye called the retina. And the retina is damaged in diabetes, and it is a retinal checkup that is required. And by looking at the ophthalmologist notes, I can make out if the retina has been tested or not. So therefore, always bring all the notes, all the previous doctor's notes, all anything possible. If you are in doubt, please carry it. Now, we as doctors are very happy to go through printed notes. We are also happy to go through mobile, but remember, the mobile phone is a very small phone, and all of us are getting older, and we have to look carefully, and the chance of missing something is there, especially when you have lots of information on your mobile phone. Also, when you enter the doctor's chamber with your reports on the mobile phone, sometimes the internet may not be working in the doctor's chamber. Sometimes the signal may not be there. And as a doctor, I want to know, what was your blood glucose level 6 months back or 1 year back? And then sometimes that information may require internet. And if that's not available, then, again, you'll have to go email it to the doctor, take printed notes. So wherever possible, take a printed note of your results. But otherwise, a mobile, make sure that it is downloaded and on your phone. So sometimes patients don't know what to say, and when they come to my chamber, they tell me, "Doctor, I've got diabetes for 16 years. Do you want to hear the whole story?" So do not be afraid of the ocean, because the ocean is made of little drops. Similarly, talk freely to your doctor, because whatever you are saying, the doctor can extract the right information from what you are saying. So it's important to go to a doctor who gives you time to discuss, because the idea of going to a diabetes doctor is to know that what is diet, what is exercise, what are the medications, when you should be taking them, how you should take insulin. For example, today, many patients follow some special diet. Some people follow a diet called intermittent fasting. They eat only 2 times a day. It's very important that the doctor knows this, because some of the tablets used for diabetes can cause low sugars, very low sugars. So therefore, by knowing that, the doctor can prescribe tablets which will not produce low sugars, which bring only high sugars to normal. So many people with diabetes, I think it's important to tell the doctor freely. Now, supposing you order a general checkup, always order the tests what the doctor has asked you to do. For example, if you're going for diabetes and thyroid tests, I think many labs now do all the tests possible. Vitamin D, vitamin B12, copper, arsenic, lead. Remember, many of these tests are not important and will lead to unnecessary prescribing. 80 to 90% of the population is vitamin D deficient, and more than 50% are B12 deficient. So by keeping on testing vitamin B12 and D, you are creating artificial tests, artificial results. Sometimes when a test is done without any reason, you get a report which you can't interpret. So only do the test which your doctor has set, and ideally, don't do any other test. So how to rate your doctor? These are some ways. Very interesting publication I found about how people rate the doctor. So the doctor should always check, have you fully understood what we are saying? Is there anything else you want to know? Did you feel comfortable? All doctors are busy. Many doctors can see the patient for just a few minutes, but that's not the thing. How comfortable did that doctor make you feel? Did the doctor use simple language to express the issue? So using a jargon-free language. Did the doctor encourage you to participate? Earlier, diabetes care meant that the doctor will tell the patient, you take this medicine and come back and see me. But today, evidence-based diabetes care means that the doctor understands the scientific evidence, he uses his clinical experience, and he respects patient choices, and then treats the patient. Does the doctor give you an opportunity to question? Doctor, why are you writing this medicine? The doctor may say, हाँ ये दवाई ले लो, sugar ठीक हो जाएगी. लेकिन doctor, can I know what the side effects are? Many medicines for diabetes have side effects, many of them have good effects. Focusing on the side effects is a good thing, but important to focus on the good effects also. Many people are worried about side effects, but I think that discussion is very important, and the doctor explaining the condition, addressing the concerns. Today, many people, when they go to a doctor, they are asking, should I take this medicine long term? Can I reverse the diabetes? Yes, you don't have to take medicines long term always. And we don't use the word reversal of diabetes anymore. The correct term is remission of diabetes. Diabetes, the common form of diabetes seen in older people is type 2 diabetes. Type 2 diabetes has two problems. One is that uh, insulin is not produced, and second is that does not work. What is insulin? Insulin is a little hormone produced by a little gland called the pancreas in the abdomen. The job of insulin is to lower the blood glucose to normal. So when insulin is not produced or insulin does not work, then the blood glucose goes up. Majority of the treatments for diabetes, tablets for diabetes, make the body make more insulin or make the insulin work better. And also sometimes when both don't work, you may have to just inject insulin to control the sugar. Unfortunately, insulin cannot be eaten because it will get digested. That's why it has to be injected. Many people today with good diet and exercise, they don't need medication. And sometimes by following diet and exercise, they can also stop the medication. But that should be only under a doctor's guidance. Because sometimes recently I saw a patient who was looking very starved and thin and emaciated and very frail. The blood glucose level is normal, but I asked, the patient told me, doctor, I followed a particular diet and now my blood sugar is normal, but I'm feeling so weak that I cannot stand. Because if anybody starves, they can control their blood sugar level. With enormous willpower, you can starve and you can control your sugar. But is that what we are hoping for? Our goal is health. And therefore, if you can follow diet and exercise and be healthy, then diet and exercise will do. But supposing you are following diet and exercise and the sugars are high, but you decide to starve yourself, yes, the sugars may get controlled, but you will start losing your muscle mass, feel weak and tired with muscle pains. Now, going on to diabetes and explaining the condition, given the limitation of time, let me just talk about one test in diabetes. That's called HbA1c test. What is HbA1c? HbA1c is the commonest and best test in diabetes. It's a simple test because it does not require fasting. It gives you long-term blood glucose levels. So one single blood test can give you an average of 3 months. And more importantly, it correlates with diabetic complications such as kidney disease, heart disease, foot disease, eye disease, and also high HbA1c predisposes to diabetes related infections, COVID, tuberculosis, and the recently came into public prominence, the black fungus disease or mucormycosis. That's the correct term. So it's important to keep the HbA1c under control, and you can do the HbA1c any time of the day. You don't have to fast. You can do it in the afternoon, morning, evening, and it's an important test because it predicts diabetic complications better than a simple test on your glucose machine, which will tell you instantaneous glucose reading, or even a lab fasting or khane ke baad wala glucose levels. Better than that, HbA1c correlates with diabetes related complications. But what is HbA1c? HbA1c is glycosylated hemoglobin. We all know hemoglobin. Hemoglobin is a protein that lives in little cells called red blood cells. Red blood cells carry oxygen and hemoglobin helps to carry that oxygen. But it's important that when the blood glucose levels are high, glucose starts binding to proteins like hemoglobin. Glucose also binds to proteins in the eyes, the kidneys, the heart, and the feet. That's how diabetes causes damage. Today, diabetes is the number one cause of kidney failure, dialysis, and transplantation. Diabetes is one of the most important causes of preventable blindness. Diabetes is the most common reason for damage to the feet, low blood supply to the feet, or gangrene of the feet, or surgeries to the feet. Diabetes is the important trigger factor for heart attacks, and uncontrolled diabetes, poses a risk for diseases like COVID. But you don't have to worry, because if the blood sugar is controlled, you are minimizing the risk of kidney disease, minimizing the risk of heart disease, minimizing the risk of foot disease, minimizing the risk of eye disease, and minimizing the risk of COVID. So if a patient or a person with diabetes, if their blood sugar is controlled, weight is controlled, blood pressure is controlled, cholesterol is normal, they are like any other patient. They are like a non-diabetic person. They don't have a risk of diabetic complications. But coming back to the story, glucose binds to proteins like hemoglobin, and therefore the quantity of glycated hemoglobin, or the proportion of hemoglobin that is bound to glucose, can be measured. So that is called HbA1c. So single measure of HbA1c gives you 3-month average of glucose, because as I said, red blood cells have a protein called hemoglobin inside the red blood cells, and red blood cells have a life of 3 months. In normal people, less than 5.7% of hemoglobin is bound to glucose. If more than 5.7% of the hemoglobin is bound to glucose, we call it abnormal glucose level, but it doesn't mean diabetes. So HbA1c is a simple test, does not require fasting, gives an average of 3 months, and correlates with diabetes complications. And HbA1c, it is an important marker of glucose levels. Sometimes a patient comes to me and says, HbA1c is high, but blood glucose levels are normal. So what does the doctor think? The doctor says, oh, your 3-month average is high, but yesterday's blood glucose level is normal, which means that the last 3 months, the glucose levels have skyrocketed into the sky. But 2 to 3 days before coming to the doctor, maybe the patient has stopped eating pastries or cakes and has followed a strict diet so that they get good marks. So the glucose level marks are good 2 to 3 days before, but the HbA1c is high, and that shows that the situation is not okay, which means that yes, before coming to the doctor's chamber, the patient has controlled the sugar, but last 3 months things have not been good. On the other hand, sometimes patient comes, doctor, today my blood sugar is 300, but my 3-month average is just 6%. It's very good. That means the sugar is controlled, but last 2 days something has happened. What has happened? Maybe their children's exam, or some stress, or grandchildren's exam, or maybe they had an occasional cake. And people with diabetes, they can eat an occasional cake or a sweet. They should not eat it daily, because little drops, as I said, make an ocean. But occasional sweet, and that may have spiked the sugars. But if the 3-month average is normal, then they are okay. So how to interpret the 3-month average? As I said, the HbA1c test, if it is less than 5.7%, it is normal. If it is between 5.7 to 6.4%, and this I'm talking about in people without diabetes, and I'm aware that 50% of senior citizens have diabetes, but I'm talking about the 50% of senior citizens who don't have diabetes, who want to know if they have diabetes. They can do the HbA1c test, because that gives a 3-month average. So if you don't have diabetes and you want to find out if you have diabetes, if your HbA1c is less than 5.7%, it's normal. If it is between 5.7 and 6.4%, then you have a condition called pre-diabetes. Pre-diabetes is an intermediate stage. Pre-diabetes means blood glucose levels are high, but not high enough to call diabetes. Pre-diabetes is not a disease. In fact, we should not misuse the term pre-diabetes. Many people come and tell me, doctor, I have pre-diabetes. Can I go for a job? Doctor, I have pre-diabetes. Can I get married? No, pre-diabetes is not a disease. Pre-disease is not a disease. Pre-hypertension is not a disease. But what is it then? It is a signal that there may be a future risk of converting to diabetes. So if you have pre-diabetes, you just have to follow a little carefully your diet and exercise so that you can prevent diabetes. Pre-diabetes is very common in older people, and pre-diabetes does not require medicine. It requires little more strict diet and exercise. What do I mean by diet and exercise? Pre-diabetes people should reduce their carbohydrate intake. What is carbohydrate? Carbohydrate is any food that you eat that gets converted to glucose. For example, sugar, honey, jaggery, dates, sabudana, it contains carbohydrates. Rice contains lots of carbohydrates. I'm not saying don't eat rice or don't eat sabudana, just limit the consumption. Bread is carbohydrate rich. So it's important to control the high carbohydrate foods, not stop. But if the HbA1c is more than 6.5% or equal, we call it diabetes. This means that more than 6.5% of the hemoglobin is bound to glucose. As I said, hemoglobin lives in a red blood cell, and a red blood cell in the body has a life of 3 months. So this means that, yes, you have diabetes because you have 3 months your blood sugar has been high because the HbA1c is more than 6.5%. So that is the importance of the HbA1c test. But let's look at the other 50% of senior citizens who already have diabetes. If you are a senior citizen and if you already have diabetes, how much should be your sugar control? Your HbA1c should be below 7%. But this is not true for everybody. In a very young person, we try to keep HbA1c below 6.5%. But in older people, we like to keep the HbA1c around 7%. And very old people, people above 90 years of age or 85 years of age, we will keep their HbA1c 7.5 or even higher. Why the difference? Why am I looking at younger people deserve very tight control, older people, I'm relaxing the glucose control? That is because studies have shown two things. Studies have shown that if you go for very aggressive glucose control in older people, number one, it may not give benefit. Studies have shown no benefit. Number two, it may cause what is called hypoglycemia. Hypoglycemia is very low blood sugar level, which means the sugar falls to below normal. People can get hungry, angry, sweaty, trembling, irritable. And then if you don't treat that, people can become unconscious. That can lead to heart attacks and strokes. So in older people, it is important to change the goalpost a little bit from the safety perspective. So today, earlier we were saying everybody should reach HbA1c of 6.5. Today we say no. We want to personalize the diabetes care. If your HbA1c is around 7% and you are a senior citizen and you don't have low sugar, that's perfect. But if you are, say, 85 or 90 years old and your HbA1c is 7.5%, that's fine, because we don't want to have even one low sugar in such people. So therefore, it's important to follow individualized A1C targets. I also would like to say that exercise is not about walking 20 to 30 minutes a day. But if you have diabetes, the minimum amount of walking you should do is 20 to 30 minutes a day. So I've looked at what to do before entering. I've looked at what to do during the consultation. I've also stressed the importance of discussing with your doctor about what is the science of the test and the science of the medicine. And I talked about an example of the HbA1c test. The single most important test in diabetes is HbA1c test. Now, before leaving the doctor's chamber, 2-3 things are very important. Very simple things, not really rocket science. Important to discuss the date of the next visit. Second, whom to contact if there is an emergency. And finally, recheck your medication list and clarify all the doubts. After going to the house, you can always call the doctor back, but then the doctor's memory may not be as good as it is when you are in front of the doctor. So check your medication list, clarify all the doubts, ideally before leaving the doctor's chamber. Especially for diabetes, it's very important. And in lifestyle diseases like diabetes, the doctor is like a coach. We are there with you, but the patient has to fight the little battles in front of them. that little piece of chocolate which you have to resist, that getting out of bed in the morning to go for a walk. All these are little challenges that people with diabetes have to overcome on their own. But we are like a coach. We try to inspire and motivate you, because it is nothing to worry. It's a very simple disease to treat. And if you have controlled your sugars with diet, exercise, and if needed medication, you're protected forever. So the doctor is like a coach who will just inspire you, but you will have to, as a patient, you will have to follow your diet and exercise. So I've looked at before meeting your diabetologist, what all to do. During the consultation, what can you do to maximize the information that you can get from your doctor, and before leaving, what are the things you should follow. And I'd like to say that we as doctors are coaches, and the today's mantra in diabetes care is personalized or precision diabetes care. Choose the treatment according to the person, according to the social circumstances, according to the behavioral circumstances, according to the family support, according to the wishes of the patient, rather than blindly insisting on increasing medicines to reach target. And also, we doctors have increasingly accepted the importance of diet and exercise, which is at the core of diabetes management, and not always depending on medicines. I'd like to take this opportunity to thank Mr. Bhalla, Mr. Unni, Mr. Srihari Sidaye, and all of you for inviting me here.